Good day, everyone. Our topic for today is one of the leading cause of cancer deaths. This type of cancer is known as bowel cancer. To start with, we'll be looking at what is this bowel cancer, what are its predisposing factors, what are its symptoms, and what you as an individual, if vigilant, can notice in your parents, any elderly person, more especially those above the age of 45, and help them in seeking out the right medical attention. That being said, what is bowel cancer? I believe most of you are acquainted with the word cancer, but what is bowel? Bowel is a segment of our digestive system beyond the stomach. It has various parts, which includes the small intestine, the colon, and the rectum. When an adenoma, a polyp, grows in the inner lining of this segment, then it is known as bowel cancer. It is more common in the colon and the rectum part. That is why bowel cancer is also known as colorectal cancer. The risk of developing bowel cancer increases with age, which means the older you are, the more likely you are to develop bowel cancer. But there are also other predisposing factors, like consuming alcohol, smoking, and eating food with high fats and low fibers. The symptoms of bowel cancer includes bloody stool, more especially when the blood is mixed with the stool. Unexplained anemia, which leads to tiredness and sluggishness. Unexplained weight loss, you need to look out for that. And then change in your bowel habits, when you begin to go to the restroom more often or less often than you used to. And one more is back pain, more especially when the back pain has no any etiological explanation and there is no any obvious reason for that back pain. You go to the hospital, maybe an x-ray is taken, and we're being told nothing is wrong. It's something to look out for in bowel cancer. These symptoms are not specific to bowel cancer, all the symptoms I've mentioned. But then, if they assume persistence, not especially for 6 weeks or more, then it is our time to seek out medical attention to evaluate whether it is bowel cancer or not. And the good thing is that over 90% of bowel cancer have been cured successfully, more especially when you're noticed at the early stage. So if you notice these symptoms in any elderly person, then you should suggest they look out for medical attention to evaluate whether it is bowel cancer or not. And by doing so, perhaps you might become a savior of a potential bowel cancer subjects. Thank you.